So who is microneedling good for? Well, in theory, most skins, but a consultation is always performed beforehand. However, with your microneedling, it is great for scarring, it's brilliant for stretch marks, great for acne scarring, any sort of acne when you get all of these little tiny ice pick scarring, great for pigmentation, really good for premature aging, so any sort of fine lines and wrinkles on the skin, any sort of thick UV textured skin, but really great for general all over skin quality. So a lot of my patients actually have good skin, but when they have a microneedling treatment, they have better skin quality. So when I take you through all of the benefits, adding to the skin quality, you'll get a really dramatic reduction in your fine lines and wrinkles. So microneedling is a beautiful option to run alongside your toxins and fillers. So if you're having any injections, microneedling is nice to have as a added option. So what is microneedling? So microneedling is when you take lots of needles and you repetitively penetrate the skin, causing lots of micro incisions on the skin. So when you have microneedling, it creates a skin cascade, or you will induce wound healing, which will stimulate your fibroblasts, which will stimulate collagen production. You will stimulate tissue remodeling. You will start more capillaries to form in the skin, so you'll get more vessels starting to form. Lots of little holes or lots of little micro lesions in the skin. Now that needle piercing or penetrating of the skin stimulates a skin cascade or a skin process to start to happen or start to change. So you will first of all induce wound healing. Then you will stimulate the fibroblast cells to start to produce more collagen. You will stimulate tissue remodeling. You will start to have more capillaries starting to form within the skin. Your fibroblasts will continuously proliferate. Your skin will start to tighten. And you will start new skin cell production. So your skin will be kicked into touch. Now that process of collagen synthesis can actually take up to 12 months. So I've seen patients who have initially had treatments, seen some great results, but then when I show them before and afters of 12 months, generally they're quite shocked at what they've achieved within that process, just because your collagen synthesis or regeneration can take up to 12 months. And generally I tell people that every time they have a consultation. So the process of microneedling is, it's an inflammation injury, then you will start to get tissue proliferation, your tissues will remodeling, and then what happens is that you will increase your dermal thickness or volume. So on the outer layers of the skin you have your epidermis, deeper down you have what is called your dermis, and these generally are where all of your cells are, which will help with that premature aging or to help to regenerate the skin. So as we age, that dermal volume and thickness will become much thinner. So every time you have microneedling and that needle penetrates the skin, that will increase dermal volume, and we all want collagen and dermal volume. Now the clinical trials that were done on microneedling have said that within a 5-month period there is a thickening or dermal volume increase from 0.5 mils to 2.41 millimeters. So that's a huge increase just from your microneedling. Now when we look at tissue remodeling, the trial which was done on tissue remodeling, so after 6 months, the more collagen elastin were detected, and there was a 400% increase on collagen remodeling, which is huge. So whenever you have a treatment, every time you come in for treatment, you will always have a full consultation to ensure that you have no contraindications to allow you to have the treatment. If you go ahead with the treatment, a topical application of a numbing cream will be applied, and this just takes away some of your sensation ready for needles. Once I start to apply the microneedling tool to your skin, there's generally different thicknesses of skin. So depending on how deep the needles will go or how shallow the needles will go, it depends on your skin concerns and also the density of your skin or the outcome that I need required when I start that needle process. Generally, you might just feel a tickling sensation or vibration from my tool. However, some people can feel a slight, almost like, let's say, irritation to the skin. So once you've had a treatment, your skin can look quite red, it can feel quite tight, and it can feel quite dry. Now, when you've had a treatment, it looks obviously really red. So I would say to anybody, just ensure that you have no engagements after you've had a treatment. So it's generally good to go home after you've had a treatment, and then once you have had a night's sleep, by the next day you won't know that you physically had a treatment. But when we look at all of the holes or the microscopic holes on the skin, you can't apply anything to your skin for 24 hours. So no products at all to be applied to the skin. So now in this picture here around the eye area, dramatic results in a reduction in fine lines and wrinkles around the eye area, and that's just after one treatment of microneedling. Also, I have recommended and the patient has used home care products, but that result is off one treatment. So whenever you look at microneedling, it's always about skin quality. So the image you can see now is a patient who has had home care products but has only received one microneedling treatment, and you can see the difference in before and after in that skin quality. The skin looks healthier and it looks more radiant.